Good morning, everyone, and welcome. I'm Delaware County Council Chair, Dr. Monica Taylor. This morning, you will hear from Delaware County Health Department Director Melissa Lyon and Brian Corson, founder of MVP Recovery, and a member of the Delaware County Opioid Task Force about a preventative and innovative tool the county will be using to help combat drug addiction and drug overdoses in our county. There is an overdose epidemic throughout the nation, and Delaware County has not been spared. Hundreds of precious lives have been lost, and thousands of families have been affected by drug addiction and drug overdoses. We know that the single most powerful weapon to fight this epidemic is prevention. Last year, the county was awarded a total of $63 million in annual payments over the course of 18 years as part of a $26 billion multi-state opioid settlement with Johnson & Johnson, AmerisourceBergen, Cardinal Health, and McKesson. Delaware County was the first county in the state to sue for damages against suppliers of opioids and their consulting physicians. To ensure that the funds are used to combat the opioid crisis to the best of their ability, Delaware County formed a task force to provide recommendations to County Council for short-term and immediate uses, as well as long-term programming that can be supported by this funding. Several of those members are joining us today. I'd like to thank them for their efforts over the past year in strategizing ways to maximize our use of the settlement funding. As you will hear, prevention is a key goal of the task force. Today, our county leadership, the Delaware County Health Department, and members of the Opioid Task Force are here to announce the launch of the Deterra Drug Deactivation System pouch, an outreach postcard mailing campaign. The Deterra pouches and outreach postcards are intended to help destigmatize substance abuse disorders, remind residents about avenues for help in our county, protect the environment, and prevent drug abuse and addiction. You will hear much more about the program of the county from the county's health department director, Melissa Lyon. I urge all residents to learn how to utilize the pouches to protect their loved ones and the community. The program is easy, and it's a powerful and effective tool to keep unneeded and expired medications out of the hands of those who may abuse it. I'd now like to invite our director, Melissa Lyon, here to help and tell us more.
Thank you, Dr. Taylor. It's a pleasure to be here this morning with everyone to talk about this exciting initiative. And I do have to thank the community and council, my other department directors that have really supported the health department in their first couple of years in creation here. We'll be 2 years old in April. And it's allowed us to be innovative and think differently, approach our health outcomes with a way that maybe would not have been an opportunity in the past. So I really want to thank everyone. The Delaware County Health Department didn't do this alone. We did this with a lot of help and support for those that are standing here with me, those in the audience, and those that are in the community that couldn't be here today. I am going to talk a bit from my heart today. I feel that this project deserves to have some compassion and some empathy brought to it as opposed to just reading my notes. But public health is based upon principles that prevent the spread of illness, disease, unintentional injury, and premature death. So ultimately, public health is responsible for promoting healthy lifestyles and behaviors, and we protect the natural and built environments where we live, work, play, worship, etc. We build healthy communities through evidence-based strategies and best practices and policy. So today I'm really excited to announce that the evidence-based best practice strategy of the Deterra Drug Deactivation System. This is a mailer project that we decided to pursue. This is a harm reduction strategy that is deployed to remove, deactivate, and discard unwanted and unused medications conveniently and environmentally safely. We will be, as early as this week, sending out, or they have been sent, about 70% of the population or residential addresses, that's 165,289 addresses throughout Delaware County, were randomly selected to receive one of these pouches. So they should be coming in the mail any day. And we strategically placed this around the Christmas holiday. I'll tell you a little bit more about that. It was a random selection process that was used because nearly everyone in every corner of the county has unused, unwanted, or expired medications. So this is good for all. I'm going to take a minute and demonstrate the pouch. So, Matt, shall I move over to this area to do so? So the pouch that you'll be receiving is a medium pouch. The medium pouch can take 45 pills or films, 6 ounces of liquid, or 6 patches. When you receive it, when you open it up, conveniently, it's got one of those zip ties. So then it's got the deactivizing components are in the middle. I seem to have logistical problems. Sure, perfect. We take the meds, we dump them in there. We'll discard of this appropriately. Then you take water. You add water till they are basically fully covered. You seal it. And you can shake it up. You'll begin to feel all the things come apart. And then it says, wait 30 seconds for air to release. Some foaming may occur. So if we need to release a little air or not, hold on. I didn't practice. Dr. Taylor? We did not practice. We release a little air, and then we seal it for one final time. All of the medications in there should be deactivated, and you can throw it away in the garbage. Whew, I got through that. Thank you for your assistance. The smaller pouches, which I wanted to show, these will not be coming in the mail, but these are available as well. They have 15 pills or films, 2 ounces of liquid, and 2 patches. So public health is required to remove barriers for access to health care, resources, programs, and activities. The Deterra disposal bags is a convenient, at-your-doorstep solution. It is in addition to the medication drop boxes and drug take-back days. It's not in replacement as. And I thought I would share my story. When my father passed, he was on a lot of medications, and he had stored medications under his bed, in closets, in cupboards, in drawers. And so when we were cleaning out his home, the amount of medication was really astronomical. I was incredibly surprised how much unused and expired medications had accumulated over the years of his chronic illness. And I put them in shoe boxes. And I had probably 15 shoe boxes full of medication. And I brought the shoe boxes here to the drug take-back box that's in the government center. But I didn't do it all in one day, and I'll be honest, because I didn't want someone watching me carrying like 15 bags of boxes of medication. So I did it over 3 days. I'm sharing this story because I did the right, responsible thing to do. I had a car to get here. I had a way to get my meds in there. I didn't have to go through security to come in to do it. And so it's convenient, but it's not as convenient for someone that may not be able to have any of those resources. So in public health, our responsibility is to minimize barriers. So that is one of the main reasons we're sending one of these to everyone's home, 70% of the homes in Delaware County. Get people to get used to them, understand them, want to use them, and then they'll have an ability to request more into the future as we build this program out. So we want to make a drug disposal a household priority, and that is one that is easy and environmentally responsible. There'll be a postcard that's included in this mailing as well, and I want to talk about this postcard. It will have messaging around resources that are available for anyone that may be in a drug use, misuse situation and or experiencing addiction or have a family member that does. And this postcard is designed to begin to normalize the conversation around addiction, treatment, and recovery. And the postcard is step one to encourage people to normalize and destigmatize addiction and drug use disorders, substance use disorders. And I want to move this conversation, and I want to be in a space that we support the conversation of treatment and recovery. Our job in public health is to have destigmatization around things that are difficult to talk about. We want to be able to bring empathy to this public health crisis. I'm not an expert on drug addiction or substance use disorders, treatment or recovery. But as a public health director, I am responsible to begin to destigmatize the conversation when it comes to preventing injuries and illness, disease, and premature death. We have destigmatized conversations around cancers, HIV, AIDS, and teen pregnancy. It is time we do the same for substance use disorders, treatment, and recovery. Everyone deserves the support they need to seek treatment and find recovery. I hope that this postcard that's included as resources will generate an empathetic and a caring conversation this holiday season as we move into a bright and hopeful 2024. Thank you. And I now hand it over to Brian Corson, MVP Recovery Founder. Brian, it's yours.
Good morning, everyone. My name is Brian Corson. I'm a licensed clinical social worker, a certified advanced drug and alcohol counselor, a relapse prevention specialist, and also a person in long-term recovery. I had the privilege of speaking here this morning and was asked to talk about the importance of disposing unwanted and expired medications and why this program is so important here in Delaware County. The importance of getting rid of these, I had a whole bunch of bullet points I was going to go down. And as I was leaving my 5-year-old's pre-K holiday celebration this morning, and I saw those 20, 25 kids singing, dancing, having a great time, you know, it was very easy to realize they are why it's so important. Those kids and every kid in Delaware County. Because the harsh reality is that opioid use, heroin use, fentanyl use does not always start out in the streets. More often than not, sometimes it starts right in an adolescent's home, right in their medicine cabinet. 62% of teenagers say they misuse prescription drugs because of their accessibility, because they're so easy to obtain. And that's what this program is designed to do, to mitigate that accessibility. As we talk about the importance of disposing of these medications, we talk about combating this epidemic that we're still in, that Dr. Taylor spoke about. We need to combat it from all fronts. We need to address it from all areas, and prevention is a main point of that. And education, the fact that this program talks about educating the community on the dangers of prescription drugs. 35% of teenagers say that they think it's safer to misuse prescription drugs than to use other illicit substances. Oftentimes it's discussed that it's similar to experimentation that many adolescents have with other substances such as alcohol and whatnot. But the reality is, opioid experimentation rapidly transitions to dependence, which causes individuals to go down that pathway of opioid, heroin, and fentanyl abuse. Nearly 1/3 of all adolescents that misuse prescription drugs before high school will be abusing opioids after high school. That's why it is so important. That's why this initiative, and I thank our county leaders for implementing this. And I encourage all Delaware County residents to utilize this and allow this new program to become a ritual, to become a habit when it comes to getting our prescription drugs and how we dispose of them. Because this is a relatively simple program that can have a very powerful impact by mitigating the accessibility of prescription drugs for our youth, by combating this epidemic, by assisting some adolescents not to go down that pathway of opioid, heroin, and fentanyl abuse, and ultimately to help save lives here in Delaware County. Thank you.
Monica, you might have said this, but I missed it. How much is this? How much of the funds that the county is getting go towards this program?
For this program, it's about $1 million.
And who's administering it? Is it
It's through the health department. So the health,
like third-party contractor administration?
no, besides Deterra, which is the company. And so the health department has been working with them to put together the postcard along with identifying the households where it will be mailed to.
And how did the county learn of it? I've never even heard of these stats.
Yeah. So, thank you for asking that question. When we go to public health conferences, so two things. I sit on the National Association for City and County Health Officials sort of planning committee for conferences. So that's one thing. And then I'm also part of the State Association for City and County Health Officials, so county SHOs. So we have access to resources and sharing information. So when other health departments are utilizing certain resources or programs, we share amongst ourselves. So that was one way. And then second is I went to the conference and I went to their booth and took a look at what they had to offer, and then talked about pricing and how flexible were they on pricing, how flexible were they on messaging, and then demonstrating if we would have funds. So interestingly enough, the Delaware County Health Department was planning to pursue this project on a much smaller scale initially with funds because we weren't knowing that the opioid settlement funds would be an option for this, and it was going to be a smaller scale. So we're so appreciative of being able to scale this up as quickly as we did and get it into lots of people's hands in Delaware County. And then we will continue to do a sustainability project, which would be the second sort of phase of this. How can people request them? Where will they be available long term? And I did want to say, don't ditch this pouch when it arrives at your house. Really, we're saying don't ditch it, deactivate. And if you don't feel that you have a use for it, don't throw it away before using it. Share it. Ask someone else if they want it. Start that conversation about why you received the pouch and what it's to be used for. Thanks.
Is there any update on the Narcan issue? I just saw that you guys were here to ask one.
Yeah, I can speak to that. Yeah, the county continues to support the Narcan program. Under Dr. Taylor's leadership, we really have formed a true partnership here where every department in the county is basically focused on taking care of this epidemic. We're very successful. We're giving away for free. And with Dr. Taylor's leadership, I think this could even become one of those programs that we join together. So,
Any update on numbers or anything like that?
Narcan given away this year? We receive over 5,000 doses a year and distribute them across. And again, they're available from any police, fire department, and many community groups, including county offices. There's no reason not to have Narcan in your home. And again, this is another tool that's going to save lives. So, Dr. Taylor, if you don't mind, would you mind a little closer demonstration, Jack? Would that be better for you, the pouch and things?
Sure.
Okay.
Okay. All right.
There you go.
All right.
Thank you.
Thank you all.
Thank you.